Nursing ethical values. This includes human dignity, privacy, justice, autonomy in decision-making, precision and accuracy in caring, commitment, human relationship, sympathy, honesty, and individual and professional competency. The basic principles that serves as a baseline for ethical nursing practices are beneficence. This means doing what is best for the patient. As a nurse, you must be committed to helping patients and seeking out the best possible healthcare outcomes for them. Non-malfeasance, making sure no harm is done to patients. As a nurse, you must make sure you are not purposely harming patients in your care. While treatment or procedure can have negative impacts on patients, nurses should not cause intentional harm. Fidelity. Nurses should be faithful to their promises and responsibility to provide high quality and safe care. Accountability. Nurses must accept personal and professional consequences for their actions. Veracity. Truthfulness is a cornerstone in nursing and something patients depend on. Patients should be able to depend on nurses for the truth, even if the information is distressing. Justice. Ensuring that patients are always treated equally, fairly, and impartially. Patient autonomy. This involves honoring patients' right to make their own decisions. Patients are entitled to know about all of their treatment options and have the right to make decisions about their health care based on their personal beliefs. Patients have the right to refuse treatment or medication. Nurses' awareness of their values and the effect of these values on their behavior is a core part of humanistic nursing care. They need to tailor their functions to the value system and cultural beliefs of their service recipients. Ethics in customer dealings presents your facility or profession in a good light, and clients will trust you irrespective of minor service lapses. Ethics in customer dealings improves the quality of service and fosters positive relationships. Ethics is about being able to differentiate between what is wrong and what is right, and conduct all dealings based on what is right, even when doing the wrong thing will reap richer benefits, at least short term. Nursing does not exist in isolation. It needs clients to practice, and these clients or customers have become smarter, more well-informed, and are quick to perceive if things are not going as expected. Integrity in every dealing must come naturally, and not because there will be legal repercussions. Ethics in customer dealings is doing the right thing every time and in everything. It is not enough for nurses to keep chanting, "Nursing is a noble profession." It has to show in their display that they follow strict guidelines of ethics in customer or client dealings. These characteristics must be clearly demonstrated for customers to believe them long term. Ethics in customer dealings and otherwise must be an intentional and constantly practiced attribute of any professional. Ethical dealings must be part of the professional's values and culture, and any deviation must be dealt with severely. Organizations and professions that build their best practices and culture around integrity are more likely to have a loyal customer base and happy employees. Ethics in customer dealings and all other dealings is a choice that nurses must make, and one that would reap rich rewards for the profession in the long run. Companies that choose to ignore the importance of ethics in customer dealings do not last long. Making decisions that are unethical but profitable in the short term must certainly always backfire in the long run, leading to the collapse and disintegration of the company for sure. Nurses seeking proper recognition and a great reputation must imbibe the importance of creating a culture of integrity and ethics in customer-client dealings. Ethics and etiquette in nursing. Now that I know my customers and what they want from me, how do I practically give it to them? Nurses must be capable of exhibiting certain personal traits to function effectively. Such traits as compassion, accountability, and transparency, amongst others. The ethics and etiquette of nursing as a profession is necessary for good customer relations. So, what is etiquette in nursing? Simply put, it is a set of customs and rules for polite behavior among nurses as professionals. In addition, it is a code of good manners needed to make nurses cultured while creating a lasting first impression and earning respect and appreciation in the society. So can we remind ourselves of the common things we do to our patients when they visit the hospital that are not nursing care per se? These are referred to as elements of nursing etiquette. They can improve customer relations tremendously. Some of them are greeting with a smile, if possible, a warm handshake. Calling the customer by name and titles. The sweetest sound in the customer's ear is his or her name. Keeping eye contact with patient during interaction. Applying the 3 magic words, please, I'm sorry, and thank you. Answering customers' questions politely. Being courteous. How often do we as nurses put these into action? Oops, very few of us remember to do this. Although they appear simple, they are often ignored when we are relating with our clients. That at times may be due to pressure of work or stress. Let us not forget that the way and manner we receive, respond, relate, and treat our clients have either a positive or negative impression in their mind that may last a lifetime. Such impression therefore determines future relationship and patronage. Let's consider some interesting facts. Customer satisfaction is a reflection of employee satisfaction. How you serve your internal customers is how you end up serving your external customers. There is no hard and fast rule to it. Now that we know our customers and what they want from us and the tools available to make that possible, how then do we know if truly our customers are satisfied? As a nurse, you are in position to better interact with patients than any other healthcare provider. Therefore, soliciting feedback from patients and their relatives is best done by you. You are probably wondering, how do I go about it? Download the document titled Customer Satisfaction Survey Patient and Customer Satisfaction Survey General. These surveys are adopted from HCAHPS and Vernon Memorial Healthcare. It is best to administer this survey in a conversational style, that is, having the nurse sit with the patients and their relatives to discuss this. However, it can also be given to the patients and their relatives to fill if the hospital management permits it. Note that the first survey, Customer Satisfaction Survey Patient, should be answered by the patient only. While the second survey, customer satisfaction survey general, can be answered by the patient and any of their relatives.